In this episode of At the Vets, Yuki goes under the knife to remove a suspicious growth.
I keep having this thought like, what if she doesn't make it on the surgery table?
A 20-year-old Chihuahua is rushed into the emergency room.
I'm just trying to give her some oxygen so she can breathe a little bit better.
And a final goodbye at home for Sushi.
It actually broke my heart to see Sushi in so much pain.
On the Red Dot follows 3 vets as they confront the harsh reality of life and death on the job.
Let's make sure that we have our supplies in check. My typical day starts by packing the van in the morning, making sure we have all our pharmacy supplies on hand.
Dr. Forrest is among a dozen or so mobile vets in Singapore. She doesn't work out of a clinic and mainly does house calls.
The van you see behind, that's our pharmacy, which we have to stock up every day. So it takes a lot of time, a lot of coordination. And then we'll hop into the van, we'll head off for our appointments, which last throughout the day. A lot of animals are very stressed going to the vet clinics. Clients have told me that their pets will be dragging their feet. The animals will be shaking, and therein lies the value of a mobile vet. We go to the homes, the animals go, hey, I've got a visitor, I've got a friend today, and we start playing with the animals and animals comfortable.
But today, Dr. Forrest's first stop isn't a home. Instead, she's going to the Animal Quarantine Center. The AQC provides quarantine facilities for imported dogs and cats. Their services include the testing of imported animals to ensure that they are free from diseases such as rabies.
So we have a loli here, a golden retriever that arrived in Singapore today, and I believe that he's due for rabies allergy test.
Okay.
Lolly's family has migrated from Indonesia to Australia. But due to Australia's strict animal control policies, dogs from Indonesia are not allowed to travel directly to Australia. Instead, Lolly has to transit through Singapore, where she has to undergo a quarantine period and be given a clean bill of health before she can travel down under.
Quarantine period depends on which countries these animals are flying from. Countries are categorized from categories of A to D, with A being free from rabies and D posing the highest risk of rabies. As Loli arrived from Indonesia, which is a category D country, he'll be quarantined here for 30 days for us to observe him closely to see whether he expresses any signs that could suggest exotic or emerging infectious diseases.
Animals that don't clear quarantine will have to remain at the AQC till they recover. However, if Lolly is rabies positive, she will never receive the all clear and may face euthanasia.
He arrived with red eyes when we saw both eyes had a bit of conjunctivitis. I'm not sure whether he has gone down now.
Hey, Lolly. Hi. Hi, Lolly. Hello. You've got your own leash. Hi. Oh.
He is quite heavy.
Lolly, come, Lolly. This way. All right, Lolly. Understand your eyes are a little bit red. Let's have a look at them, all right? Okay, your retina looks good. So does your optic disc. Very good. Let's see on the other side. Done. It's beautiful inside. Okay, this is a fluorescein eye test.
Fluorescein eye stain test is used to detect corneal ulcer, which can cause permanent eye damage or even blindness if left untreated.
There is no corneal ulcer. That's good. Okay, Lolly, we're going to put some eye medication for you to reduce the redness, okay? 1 drop, 2 drops. Excellent. That's right. Good girl.
Next up, a blood test to check for rabies.
Okay, Lolly, we're going to be drawing a small amount of blood from you. First thing we're going to do is to shave your arm. So it's going to be nice and clean. Wow. Cut her vein really hard. Her veins are actually very difficult to find on this leg. Her vein is not as prominent, but we'll try. Hold on. I may have to use the vein behind. Let's see how this goes.
Okay, stay.
Okay, good.
Good girl. A little bit more. Good girl. Okay, let's go. Well done. Good girl. Who deserves a treat? You do. Well done.
Australia does not recognize tests done by labs in Singapore. So, Dr. Forrest is sending the blood work to an accredited lab in the United Kingdom. Because of this logistical delay, the results can take up to a month. At Atlas Vets, Yuki, a 12-year-old Maltese, is seeing Dr. Chow for suspicious growths on her abdomen.
Hello.
Hi.
Yuki. Hello, Yuki. It's okay.
Yeah, she's very anxious. Come, baby.
Yuki on the table.
She's a very active, playful, very stubborn, and very demanding dog. But yeah, she's a bit sassy, I would say. Yeah, so that's my dog, basically. Anywhere I go, she'll just shadow me, so she's very sticky to me.
Yuki is a senior Maltese, and we found multiple lumps at the abdomen, at the bottom of the body, and then we realized they're all related to the mammary gland. So we strongly suspect that she has breast cancer.
When I first heard about Yuki's tumor from the vet, I felt quite worried because usually tumor comes with, cancer, and for a dog that is of her age, it is quite common also.
I'll just briefly explain. For dogs, they have a total of 5 mammary glands on each side. So this is the left, this is the right side. So to do the surgery, because left and right are both affected, we will remove the 3 from the right and 3 on the left.
Okay.
The main thing for the surgery is to remove the lump, because most likely it's cancerous, but we just need to know is it malignant or benign. Malignant is a dangerous one. Benign, actually, we don't need to worry as long as we remove it completely.
Okay.
We will just send off this.
For the biopsy.
Okay, baby, you'll be okay? You go with Dr. Chow.
Okay, Yuki.
It's okay, no. Love you.
I keep having this thought like, what if she doesn't make it on the surgery table? You just never know what can happen.
At Atlas Vets, Dr. Chow is removing 3 pairs of mammary glands from the 12-year-old Maltese, Yuki.
The anesthesia drug they were giving is called propofol, best known for the drug that led to Michael Jackson's death. So for a senior patient, a lot of times we are unaware of any potential underlying condition. For example, sometimes the heart is not as strong or the lungs are not as strong. So all these unknown factors will further increase the risk of the GA.
Whilst shaving the fur to prepare for the surgery, Dr. Chow discovers more lumps than originally thought.
We realized actually there are multiple small little lumps connected all the way up to here. We may need to change the plan of what we do today, so then I have to call Yuki's owner to let her know about what we found out. Hello, hi, Dr. Chow here. When we were shaving the fur, actually it's more than one lump, it's multiple lumps connected to each other. So the initial plan of just cutting out that one singular lump at the armpit area wouldn't be enough because there's multiple lumps there now. Yeah, so I guess then we will just proceed, then we see how she goes. Thank you. Teddy has agreed to the new plan where we are removing more mammary glands because they are also affected by the tumor cells. We were going to cut one line straight all the way, so we're going to cut all 5 mammary glands will be removed together. 有没有个 small kit 啊？没有 small kit 啊？我需要多点。Just pass 给我。Yeah, make sure that we remove all the cancer cells because we don't have microscopic eyes. We cannot see where the cancer starts or stops.
Because of Yuki's advanced age, Dr. Chow is being cautious with the amount of anesthetic he gives. The dog may show signs of pain if the anesthetic is too light.
Painful, you can see the patient breathing out a little bit. So then the last bit here, I just trim it off and then take out already. So all the mammary gland and the tumours are all been removed. So we'll send this to the lab for biopsy to test the tumour. Is it benign or malignant? The next task at hand is to be able to close this hole. The main thing about closing the hole is to make sure there's no tension on the skin. Otherwise, there's a risk of the wound splitting open a few days later.
If the tumors are malignant, there is a possibility that the cancer cells could spread even with the tumors removed.
There's a chance that we manage to remove all the cancer cells today. But if there is signs of the cancer cells escaping into the bloodstream, we will need to discuss with the pet owner whether we would pursue chemotherapy.
Meanwhile, Dr. Forrest, the mobile vet, gets a call to put down Sushi, a 14-year-old Persian cat.
At Happy Vet, we don't agree to every euthanasia case. In fact, I turned down quite a fair bit. Before we agree to take on a case, we will spend a good amount of time talking to the owners, understanding what the animal is going through. This cat has a very rare syndrome called fragile skin syndrome, whereby the skin just sloughs off by itself. Concurrently, this cat also has seizures. It could be something in the brain causing the seizures. I'm sure the family is really sad to lose Sushi. We'll do our best to make sure that Sushi is comfortable and to comfort the family as best as we can.
Hello?
Hi Julia, Dr. Forrest here.
Yes?
Can you let me in?
Okay.
Thank you. She sounded okay. She sounded okay. Yeah. There's a little break in the voice at the back, but she sounded quite composed. Hi, you must be Julia?
I'm Julia.
Yeah.
The kids
are
inside
okay.
the room.
Yeah.
We adopted him when we were in Dubai. Sushi was about 14 months old then. Very royal cat. We call him the Sushi King.
Sushi started developing seizures late last year. His usual vet suspected that he has a brain tumor, but decided against treatment because of his old age.
We thought that we were losing him then, but we still managed to keep him for another 8 months until now.
Okay. Hi. Oh, hello, handsome. Okay, sayang. Oh, you handsome. Okay. Okay. Okay, darling. I'm gonna take your weight, okay? It actually broke my heart to see Sushi in so much pain. Sushi has fragile skin syndrome and the skin was just sloughing off. The pain is as intense as a 3rd-degree burn. And he was bandaged up. He's in a lot of pain.
Over at Star's Vet, Dr. G is attending to an urgent case, a familiar patient that she has gotten to know over the years.
So we've just got an emergency come in. It's Pao Pao, 20 going on 21-year-old Chihuahua, a little old lady that we've been handling for years. She's had multiple issues and she's come in collapsed. She's suddenly very weak and she is not eating, she's not able to walk. I think it's a combination of multiple problems ongoing with the different organs that we've been managing out throughout the years. What we're going to do is we're going to just hydrate a little bit and we're going to keep this dog on oxygen for just a few hours. Try to get the energy back a little bit. I'm just trying to give her some oxygen so she can breathe a little bit better because she does have an underlying heart condition. I did give her just a little bit of fluids because she did look quite dehydrated as well. She does have kidney issues as well, so trying to manage multiple issues with her.
Last year, she came in for collapsing due to heart issues. And at that time, we were also quite concerned. She managed to pull through it. But when you go enough of these ups and downs, you just don't know whether is this going to be the time that we don't have her up anymore. I'm not recommending invasive surgery for Bao Bao. She has multiple organ issues, it's a bit too risky. The kidneys and liver metabolize anesthesia, and Bao Bao's kidneys are already not doing so well. Furthermore, she has a heart condition and she had multiple fainting spells last year. Anesthesia or any procedure that's going to increase stress or decrease oxygen can put her in a position that she can collapse again. Bao Bao looks really weak now, so I do worry that she might go tonight. Hi, Papa. Hi, Papa.
Bao Bao, the 20-year-old Chihuahua, has multiple organ issues, and any further tests might be too risky for the aging dog. Surgery is also not an option.
Cannot, I don't think you want to walk, right? No, the placing responses.
Since nothing more can be done, Bao Bao's owner has decided to bring her home, even though Stars Vets offer 24-hour monitoring for its patients.
Understand.
Knowing that they are going to go off and leaving them here, I think.
Yeah, I also understand that point of view, so that's why I'm also okay. At this stage, I talked to the owners, and with her age and the owners also quite prepared, or as prepared as they can be, you can never really be too prepared. They do want to bring her home to spend some time with her at home. Part of me feels that I just want her that if she goes peacefully, like it's best if if it's asleep, then there's no pain essentially. I'm attached to her dogs because I've seen them for multiple times since I first joined. I always try to compartmentalize because at the end of the day, you have to remember that you can't save everybody. So yeah. Hi, Papa.
Back at Dr. Forrest's home visit, Sushi, the 14-year-old cat, is living out his final moments, surrounded by his loved ones.
We didn't want to do it in a vet clinic because we wanted Sushi to, his last moments, to see the people that he loved and familiar with his surroundings. Sushi has been the source of joy and laughter for the entire family. It's hard to let him go, but I think it's the best thing for him, rather than to have him suffer.
I've been using a very good painkiller for him. It's the same painkiller that we are using for surgeries. It's just going to be very comfortable. Hey, Sushi, doctor's going to listen to your heart, okay? Okay, we're going to give you a little injection here, okay?
Painkillers will help ease Sushi's pain from his skin condition.
Have you decided who wants to carry him later? Maybe sit on the sofa and carry him. Then what we'll do is we will maybe move this table so we have more space for everyone.
Every morning when I wake up, the first thing is to check whether he's still alive. He's no longer going to suffer.
He's a good boy. I'm going to give you guys a few minutes just to say your goodbyes to him.
All cats go to heaven.
Thank you for being part of the family all these years. We're going to let you go, okay? You're going to cross the rainbow bridge and go kitty heaven.
I'm going to miss him a lot. The memory of him will still be there. He may no longer be
around, but he's still going to be in our heart.
Back at Atlas Vets, it has been 2 weeks since Yuki's surgery to take out her tumors. She is back to get her sutures removed.
We'll try to do the suture removal gently without sedation. Because like there's such a big wound, there's so much suture to remove. Okay, sorry. Okay, we give her a break first. It's okay. Almost done lah. Okay, we try like that. If she prefer this position, we can do in this position. 可以要不要照一下灯啊 Yeah, okay, that was painful. Sorry. So this part here, I think is painful most likely also because there's still some mild discharge, and that will mean that there's still some mild infection in this area. So after we remove the suture, we'll most likely ask Yuki's owner to continue antibiotics for a while because infection is a common complication for this type of surgery. Okay. I removed the last piece of suture already. I just went through the report. They found 3 different types of tumor. 2 of them, the smaller ones, are benign tumors, so the safe tumor. Based on their analysis, the 2 benign tumors were completely removed. So the third one, which is the biggest one, was malignant. It's carcinoma, so it's the aggressive kind, and it's grade 1.
Grade 1 is like a...
Haven't spread.
Oh, okay.
So we managed to remove the aggressive tumor before it spread to any part of the body, and then we managed to completely remove it.
Oh, that's great.
In terms of her, this is honestly the best possible outcome.
I'm so glad.
Yeah.
Thank you so much, Dr. Chow.
In the next episode of At the Vets, Taco swallows a string and is rushed into emergency.
Oh no, what's going on? Why do you eat string?
Dr. Forrest discovers a suspicious lump on Princess' chest.
A lump at this area on the 13-year-old dog is a bit worrying.
And Dr. Chow faces the harsh financial reality of owning a vet clinic.
When I sat down and calculated how much discounts I have given, that's when I realized we were in trouble.